I'm Lisa Wiborg. I'm here from Peterbilt, and thank you. Last minute opportunity, but still welcome to us. So I'll give a little brief overview of Peterbilt and how big we are, things like that, and then talk a little bit about what we're offering today and what it's costing us. We are a little over 1,000 employees right now, running about 12 to 1,300. Used to be quite a bit bigger when the economy was a little healthier, and hopefully will be quite a bit bigger again. We do have a presence all around America and internationally. Our parent company does, but we're primarily right now based here in Texas. And we have a number of healthcare offerings currently. Our employees can choose from either our custom designed healthcare plan that's unique to us, which is offered through Blue Cross Blue Shield, or they can choose an HMO plan. Their cost for the most popular plan ranges about $330 a month for family coverage. So they already have very, very competitive costs. We are considered to be one of the better employers in the community due to our benefits. And they carry a pretty low deductible, about $1,000 a year. So already a very good healthcare plan. In terms of what it's costing us, it's a little bit different on a percentage basis depending on if it's a shop employee or if it's a exempt employee. Shop employees tend to cost us a little bit less on a percentage of payroll basis, not because we offer them lower benefits, we don't, they have the same benefits, but because workers' comp takes up more of a percentage of their wage. So for our shop employees, we're spending about 11% of our wage cost. So if we look at theoretically, if a person made $100,000 a year, we'd be spending an additional $11,000 roughly for that person on health insurance. For an exempt employee, it's a little higher. It's about 15%. So the true cost is really the same between the two, but on average, it's about 11% of a shop person's wages and 15% of an exempt person's wages. So we are already spending well more than the 8% tax. Our employees are already very well taken care of without any mandates. In terms of the things that we would have concerns about with regard to this plan or questions about, we do have concerns about what the minimum threshold is. You know, we're already spending quite a bit more than the 8%, and for people to add on to our custom design plan, what we need to offer would be a concern to us. It's a very, very rich plan already, and particularly with the economy the way it is, and of course this is more of a short-term look, but with the economy the way it is, we've already had to make some very, very significant changes to the benefits, perks, policies that our employees enjoy. We have not touched healthcare, and we don't have a plan to touch healthcare right now. But hopefully, if more gets mandated on us, then we have to look at where else are we going to cut? What else are we going to take away in order to be able to afford to be competitive? Some of the areas of opportunities that we do see is we do think there's quite a bit of opportunity in the area of technology. We all know as we deal with our ordinary health insurance every day, the barriers that are there sometimes, the calls you have to make, the number of people it takes to resolve a problem, the amount of paper that you get. We do think there's significant opportunity potentially in technology improvement so that doctors and hospitals and patients can communicate better without all the paper, without all the confusion. So we do think technology is a big opportunity. In terms of the reference earlier to consumer-driven healthcare, we don't offer that as a part of our package at Peterbilt or our parent company, PACCAR. I do have a pretty significant amount of experience with those types of programs from previous employment, and I think there's significant opportunity there. Not just in the programs themselves, but the really key part is in the consumer education that comes from being in those programs. Employees become a smart consumer when they are in a consumer-driven healthcare plan. It doesn't necessarily cost them any more money or cost the employer upfront any more money. Often it costs less money. The key is that when an employee all of a sudden has a certain amount of dollars to spend, they start looking at how it gets spent. They start thinking about prescriptions. They start thinking about whether or not they use the emergency room. They start looking at their bills. I can't tell you the number of times in the last employer that I was at where we had consumer-driven healthcare where an employee would come and say, I got double billed for this. I'll tell you, since I've come where I am now where we don't have consumer-driven healthcare, I've never seen it. They don't look. There's no reason for them to look. They're not bad people. They just don't need to look. So I think there's also significant opportunity just in consumer education in a way where they're motivated to look, as opposed to just putting the EOB in the drawer. Okay, so that's another opportunity. The other thing is that we do hope that we know that there's pressure about all this. You know, we know that there was the deadline. Fortunately, you didn't adhere to the deadline. That would have been probably disastrous. It's very scary for all of us, I think. But we do hope that if there is going to be minimum mandated coverage, if that's a train that can't be stopped, that at least it will stop at the station long enough for good business input. That it won't be, to your point earlier, people that don't deal with this every day deciding what minimum coverage should be. So at a minimum, you know, we would hope that you can at least give the the opportunity for some business input.